We have someone from Brooklyn, 32 weeks. My stepdaughter lives in Brooklyn. That's exciting. Okay, great. 38 weeks in LA. Okay, guys, we are going to start. So I have a sort of talk prepared. I'm going to give you my talk, and then at the end, we will open it up. I can't hear you, so if you have any questions while I'm talking, if you can put them in the chat, and then after I'm done talking, I'm going to look at the chat and go over any questions that anyone has and hopefully do my best to answer them. So just to introduce myself, my name is Dr. Jill Campbell, and I am a licensed clinical psychologist with over 25 years of experience specializing in maternal mental health, early child development, and parenting. In addition to having a private practice, I am the curriculum director of the Parent and Me program at the Pump Station and Nursery. And the Pump Station and Nursery is a parenting resource center and boutique located in Santa Monica, California. Okay, so today we are going to talk about postpartum depression. The very first thing that I like to mention is that over the last few years, the name has actually shifted from postpartum depression to perinatal mood and anxiety disorder, or PMAD for short. So although postpartum depression is the more recognized term, PMAD is the more comprehensive term since symptoms can appear during pregnancy or after the birth of your child, or both. So in addition, postpartum depression causes most people to think that the only symptom to be aware of is depression. But in reality, depression is only one of the symptoms that you might be experiencing. So it's actually just as common to experience anxiety as it is to experience depression. So that it's important that if you're feeling anxious or we're going to go over all the symptoms, but not to limit it to thinking of only depression. So a perinatal mood and an anxiety disorder is much more comprehensive. So PMAD is one of the most common complications of childbirth. It affects 15 to 20% of women. And that's a lot, right? One out of five, as high as 1 out of 5. So although PMAD affects so many new mothers, most suffer alone because they have a fear of appearing weak or being judged by others. They may even fear that if they tell someone how they are feeling, that they will think they're a bad mother, or worse yet, that they might even take their baby away from them. What is so important to understand, though, is that PMAD can affect any woman, regardless of age, income, culture, education. If you are suffering from PMAD, you must remember that you did nothing to cause this. You are not a weak or a bad mother or a bad person, and that this is a treatable illness. And so that understanding the causes and symptoms is essential so that you can seek help. So that's what we're going to talk about today. With the right treatment and support, a woman suffering from PMAD can regain her health and begin to enjoy her role as a new mom. So I thought it would be helpful to go over what are the most common questions that people ask surrounding postpartum depression and anxiety, or PMAD. So the first one is, well, what is the difference between normal postpartum adjustment period and PMAD, right? So a lot of women experience some of these symptoms after having a baby, and there is a normal postpartum period. So becoming a new parent is stressful, and some difficulty adjusting to parenthood is considered normal. So in the beginning, PMAD can look a lot like what we call the baby blues, right? But both are caused by hormonal and emotional changes that occur during pregnancy and after childbirth. The biggest difference is the duration, frequency, and severity of symptoms. So we know about 80% of new moms will have some degree of the baby blues. And so they may cry easily, worry about things more than they typically worry about things, feel overall a certain amount of stress, and they might even have some very strong emotions. Baby blues, however, will usually subside within the first few weeks after baby's birth. If it's lasting longer than that, it could be PMAD. The second thing to be aware of is how frequent and severe are the symptoms. So if your symptoms are making it, and this is the biggest thing because it's not always easy to tell, but I think if your symptoms are making it so that your life is feeling unmanageable, it is affecting your overall well-being, um, then even if it's been less than a few weeks, you may be suffering from PMAD. So you're looking at like how often are things feeling unmanageable? How intense are they? How long is this lasting? So, what are the signs and symptoms of a perinatal mood and anxiety disorder, right? So, it's important to note that PMAD can first appear, as I said, during pregnancy and up to an entire year after giving birth. So, a postpartum mood or anxiety disorder might set in very soon after giving birth, but it can also come on suddenly months later. So, this is one thing a lot of people don't know. They might feel like, oh, I'm feeling okay, I'm going along, things are starting to get even easier and better. And then all of a sudden, they're hit with a PMAD. So, it is possible. And so, not to rule out it can't be that because my baby's 5 or 6 months old. It absolutely could be. So, what are the common symptoms to look for? So, of course, as we said, depression symptoms, so sadness, feeling depressed, loss of pleasure, also anxiety, anger and irritability, feeling overwhelmed, strong feelings of shame and guilt, feelings of hopelessness, of worthlessness, difficulty concentrating and making decisions, lack of concern for yourself, changes in appetite, so not wanting to eat or maybe wanting to eat in a different way than you did before, changes in sleep, like not being able to sleep even if the baby is sleeping, and then more severe would be thoughts of suicide. In addition, some women who suffer from PMAD have feelings of being disconnected from their baby or worry about hurting their baby. And I want to talk about that for a minute because worrying about hurting your baby, intrusive thoughts, right, are distressing, unwanted thoughts, images, impulses, or urges that pop into your mind. For example, the thought of throwing your baby down the stairs or out the window, that is considered an intrusive thought. But know that while these thoughts are really scary and really upsetting to have, they do not mean that you are actually going to harm your baby. If the thoughts are what we call ego dystonic, meaning they are inconsistent with your beliefs and personality, then they do not put you at risk for harming your baby. As many as 50 to 65% of new parents experience intrusive thoughts related to infant safety or harm. Okay, one more time. Ego dystonic thoughts that are not correlated with parents bringing harm to their baby. It is only if one's thoughts of harming their baby are ego syntonic, meaning that they are consistent with their worldview and not causing the person distress, then that is considered a delusional thought and representative of psychosis. So in this case, it is extremely important to seek help immediately. An example of an ego syntonic thought might be a new mom who has a paranoid belief that the world is evil and trying to cause her tremendous harm, and therefore killing the baby is in the baby's best interest. So that would be ego syntonic, where she doesn't think it's a distressing thought to have. Okay, so another popular question is what causes PMAD? So there's hormonal causes, emotional causes, and physical causes. So hormonally, let's look at that first, is during pregnancy, various hormone levels elevate dramatically, particularly progesterone and estrogen, and then they also drop dramatically after childbirth. There's also a number of endorphins that are produced in the placenta during pregnancy that drop dramatically after childbirth. So that rise and fall of hormone fluctuations absolutely can trigger a PMAD. In addition, there tends to be fluctuations in serotonin levels, which is your mood stabilizing hormone. When a woman weans or gets her a menstrual cycle, those alter the biochemical balances in the body too. So that will cause your hormone levels to fluctuate. And then lastly, thyroid levels can sometimes drop after delivery, and this can cause symptoms of depression. So those are the hormonal causes. Then there's the emotional changes, right? So depression and anxiety, in addition to being biochemical, are also an emotional response to loss. And any transition that we go through, even the ones that we want and we choose, they all have an element of loss involved. Loss of freedom, loss of sleep, time to yourself, time with your partner. There's a lot changing. New parents are getting used to this new identity, to a whole new normal, as well as the stress of taking care of and being responsible for a newborn. So all these things can take an emotional toll after baby's born, or while you're pregnant, thinking about these changes. And then there are the physical changes. So coping with physical pain from pregnancy, physical pain from delivery, chronic sleep deprivation. So these are all physical things that happen to your body that can cause a PMAD as well. So what puts somebody at a higher risk of having PMAD? So some people are at a higher risk than others. So there's a lot of factors. One of the biggest ones is having a previous history of depression or other mood disorder, or if mood disorders run in your family, that puts you at a higher risk. If you had PMAD with a previous pregnancy or childbirth, women who have had PMAD in the past have a 50% more chance of 50% chance of reoccurrence. Any major stresses that are currently going on in your life. So we are in a pandemic and people are going through a lot of stresses due to the pandemic, jobs, all that stuff can certainly contribute to a PMAD. Feelings of ambivalence about the pregnancy. Having a history of severe PMS or premenstrual dysphoric disorder, women who have just sensitivity to hormonal changes. If you had a complicated pregnancy or a delivery, if you had a traumatic birth experience, that puts you at risk of a PMAD. Medical complications for you or your baby, history of loss, history of trauma or abuse, if you are certainly experiencing relationship difficulties, and if you lack a social support system, that can put you at risk. Chronic sleep deprivation is a huge risk. Having a high needs or extremely colicky baby, and an abrupt discontinuation of breastfeeding can really shift the hormone levels and put you at risk. So, can we prevent a PMAD from happening? So, risk factors do not cause a PMAD. What risk factors do is set the stage for it, making you more vulnerable to it. So, even though you may not be able to actually prevent a PMAD, it is very important to look at the areas in your life which put you at a greater risk, because understanding these factors can help you to take steps to strengthen your resources and support systems. So this can help protect you as well as establish a sense of control over your situation. Studies show that your involvement and active participation will lower your risk of a PMAD. That is why it is so important to be informed and proactive, taking steps to understand and deal with areas of vulnerability in your life. Let your doctor know that your partner know what risk factors concern you the most. Perhaps go to counseling ahead of time, gain insight and self-awareness, prepare your relationship before baby arrives, discussing by discussing your expectations with your partner, how are things going to look once the baby's here, and having a support system in place. For example, maybe talking with a postpartum doula or a baby nurse before the baby arrives so that you can have easy access to help and support once the baby is here. Those things are so important. So another big question is, are there different forms of PMAD? And so yes, there are. So as we were talking about before, postpartum depression is one of the forms. It is a very common form, but it is only one of the forms. So there's also postpartum anxiety. Postpartum anxiety affects 10% of postpartum women. These women may experience anxiety alone, or they may experience depression and anxiety together. Postpartum anxiety can also include postpartum panic disorder, which includes having panic attacks along with feelings of anxiety. Then there's also postpartum obsessive compulsive disorder. So it is estimated about 3 to 5% of postpartum women will experience symptoms of postpartum obsessive compulsive disorder. So symptoms include being overly occupied with keeping your baby safe, feeling compelled to do certain things over and over again to help relieve anxiety and fears. Obsessions are thoughts that are persistent, repetitive, and can include mental images of the baby that are disturbing. That's what we talked about before, as mentioned earlier. Most women who have OCD know that these thoughts are not normal. They're very distressful to them. So they're not at risk of hurting their baby, but certainly the thoughts get in the way of taking care of the baby or enjoying your baby. Also fear of being alone with the baby. That's part of the OCD. Okay, so then there's postpartum post-traumatic stress disorder. So this often affects women who have experienced a trauma during childbirth or immediately after the baby is born. It's believed that approximately 1 to 6% of women experience postpartum post-traumatic stress disorder. And this symptoms include nightmares, flashbacks about the birth or trauma, anxiety and panic attacks, irritability, sleeplessness, hypervigilance, startling easily, avoiding anything that brings them reminders of the traumatic event, and re-experiencing in their heads the past trauma. So that is all considered postpartum post-traumatic stress disorder. And then there is postpartum psychosis. So postpartum psychosis is the most severe form of PMAD. Fortunately, it is also the rarest form of PMAD. It occurs in 0.1%, or like 1 to 2 out of every 1,000 women. The onset is usually very sudden and severe, normally within the first 4 weeks after giving birth. The most consistently identified risk factor is personal or family history of bipolar disorder or psychosis. So symptoms of postpartum psychosis are characterized by a loss of touch with reality, and they can include hallucinations and or delusions, bizarre behavior, suicidal thoughts, thoughts of hurting the baby. Those are ego syntonic, not dystonic. Rapid mood swings, hyperactivity. Postpartum psychosis is considered a medical emergency and should be treated immediately. Okay, so here's a big question, which some people don't know. And the question is, can men get PMAD? And the answer is yes, they absolutely can. It's called PPND, which stands for paternal postnatal depression, and it is very real. Approximately 14% of men experience postpartum depression after the birth of a child. Like PMAD in women, it is caused by hormonal, physical, and emotional changes related to having a baby. Yes, men experience hormonal changes during their partner's pregnancy and in the postpartum periods. What we know is testosterone levels decrease, estrogen and prolactin levels increase. Researchers speculate that this may be nature's way of helping fathers bond with their babies. While hormonal changes aren't as severe as what women experience, these shifts, along with sleep deprivation and the emotional stress, contribute to postpartum depression, or PPND in men. For men, the most common symptoms tend to be feelings of anxiety, irritability, anger, and rage. So they absolutely can experience depression, sad feelings, but actually the more common are anxiety, irritability, anger, and rage. Fathers who have PMAD are usually struggling with the transition to fatherhood. They're maybe feeling a lot of pressure in their new role. They often feel a big increase in responsibility and fear and uncertainty about the future. So, if you are experiencing a PMAD, how can your partner help? What can your partner do? So I believe the most important thing that a partner can do is to remind the person suffering from the PMAD that this is temporary, it will not last forever, and it is not their fault. That is the most important thing that a partner can do. In addition, though, your partner can be the one who actively searches for help, calls for resources. Your partner can take on extra tasks, such as doing extra chores, finding physical help like a babysitter or a house cleaner, or as we said before, like a postpartum doula or a night nurse. So finding someone to help out. Your partner can even be the one to drive you to doctor's appointments. It's very important that your partner also gets support during this time, because there's a lot being put on their shoulders. And so they are actually uh, at a higher risk of feeling overwhelmed and depressed when their partner is suffering from a PMAD. So let's say you are a family member, and of a you're someone in your family is suffering from a PMAD, um, or you're a friend. You want to ask the new parents what they need, and what you might get back is nothing. And so if you get back nothing, you want to offer up something anyway. So for example, you might say, you know what, I'd really love to help in some way. Would it be okay with you if I brought over some meals that you can put in the freezer? Or would it be okay with you if I stopped by, you tell me what time, and I can look after the baby while you take a nap? So ask specific things that you can do if they just say, no, we're fine. Lastly, and this is important, do not assume that a new mom is doing well if she is tending to her appearance. So sometimes women suffering from PMAD will work really hard at looking good so that they can feel more in control. But that doesn't necessarily mean that they are feeling good or in control on the inside. So do not let that fool you. Okay, so what are treatment options for PMAD? So PMAD is treated differently depending on the type and severity of symptoms. So treatment options include antidepressants or anti-anxiety medications, hormone therapy, TMS, which I'll explain in a minute, psychotherapy, and participation in support groups. So TMS stands for transcranial magnetic stimulation, and it is a non-invasive procedure that uses magnetic fields to stimulate nerve cells in the brain to improve symptoms of depression. TMS is typically used when other treatments have not been working. This is the most important thing I want you to take away about medications. So any kind of a psychotropic medication for dealing with a PMAD. If you are pregnant or breastfeeding, do not assume that you cannot take medication for depression, anxiety, or even psychosis. Talk to your doctor. Under a doctor's supervision, many women take medication during pregnancy and while breastfeeding. This is a decision to be made between you and your doctor. Do not make this decision on your own. Okay, so in terms of psychotherapy, it's usually recommended for PMAD is a short-term solution-based psychotherapy. So it's very common is cognitive behavioral therapy, dialectical behavioral therapy, or interpersonal psychotherapy. Okay, can nutrition help with PMAD? Absolutely, yes. Many times when we are depressed, our bodies are going to crave sugar and carbohydrates. And this is because when you're depressed, your brain is low in serotonin. And carbohydrates and sugars can temporarily boost your serotonin levels. However, if you eat sugary foods and simple carbohydrates, then shortly afterwards, your blood sugar plummets and that leaves you feeling tired and more depressed. So, therefore, it is important to eat small amounts of protein throughout the day and complex carbohydrates to stabilize your blood sugar, which can stabilize your mood. So, look for foods rich in complex carbohydrates, magnesium, calcium, folate, and omega 3 fatty acids. Also, we know staying hydrated is important. Hydration actually helps lessen anxiety, avoiding caffeine because caffeine can increase anxiety, and avoiding alcohol because alcohol is a depressant and can disrupt your sleep. So, what are some helpful tools in dealing with PMAD? So, this is probably super, super important. The more you care for your mental and physical well being, the better you will feel. So, the first big tool is getting rest. Chronic sleep deprivation is a major trigger of PMAD. Do whatever you can do to get as much rest as possible, from enlisting the help of your partner, family members, or maybe even a postpartum night doula or a night nurse, or a postpartum doula during the day. Nap when your baby naps. I know it is so tempting that when your baby is napping, you want to get a lot done, right? So we use that time to catch up on everything. But if you are tired, it is important to make that time your time to nap as well. At nighttime, what we know is if you can get a 4 hour stretch of uninterrupted sleep, that is much more beneficial than if you're woken up every couple of hours. So, if you're breastfeeding, your baby might need to eat every 3 hours at the very beginning. But what you can do is you can have your partner or a night nurse bring the baby to you for one of those feeds so that you can stay in bed. Your partner could bring the baby to you, or night nurse, you feed, and then they hold the baby, they burp the baby, and they put the baby back in the bassinet. So that way you can get a longer stretch. Once, if you're breastfeeding, once you start to pump, then you might want to introduce a bottle so that somebody can give the baby a one pumped bottle of milk during the night so that you can get that at least that one longer stretch of sleep. Okay, also for yourself, you need to set a bit of time out for you, just for you. It does not have to be a ton of time, but little breaks during the day, like having a cup of tea uninterrupted, or taking a long shower or a bath, listening to music, meditating, whatever it is that relaxes you. Give yourself some of these little breaks to rejuvenate you. This is so, so important. Think of the metaphor of the airplane when the flight attendant tells you that you have to put the oxygen mask on yourself before your child, because if you run out of oxygen for yourself, you can't help anyone else with their oxygen mask, right? You need to help yourself so that you can help your baby. So little bits of time that you take for yourself, so important. Nutrition. So, as we mentioned earlier, eating healthy, drinking a lot of water is very important. Sometimes this is going to mean accepting meals from friends or temporarily using some type of food service. I always say the holidays are coming up. So, this is a really good gift for family and friends to give you like a few months of a food service so that you don't have to cook, so that you can eat well and also maybe have some more time. It's very important. Getting out of the house, right? New moms tend to isolate, and we are in a pandemic. So, this makes things very challenging. But studies do show that sunlight lifts our mood. So, if you can get at least 10 to 15 minutes of sun a day, that can really help lift your mood, vitamin D, etc. Exercise. Exercise gives you a boost in endorphins. This is your feel good hormone. So, studies show that moderate exercise may be as effective as medication when it comes to treating depression. So, I'm not sure about that. That is recent research though, but it absolutely helps. There's no doubt that getting your endorphins going helps stabilize your mood. You don't need to overdo it. So it can be taking a long walk, it can be live streaming your favorite exercise class, it could be dancing in your living room, whatever it does that brings you joy, that gives you some exercise is super, super helpful. Getting emotional support. So when you're feeling depressed and anxious, it's more important than ever to stay connected to family and friends. We are wired for connection, it is what makes us thrive. And so even if you feel like you'd rather be alone, um, isolating only makes you feel worse. So let your loved one know what you need and how you'd like to be supported. Share what you're experiencing, the good, the bad, everything with at least one other person. You need that person who wants to listen without judgment, and is able to offer reassurance and support, not just tell you what to do. So you need that person. Um, I really believe in joining a group of new mothers. So even if you have some supportive friends, it's a good idea to reach out to new moms who are also transitioning to motherhood. It's very reassuring to hear other mothers share their stories, their fears, their worries, their insecurities. At the pump station where I work, we have these amazing groups. All the groups are formed according to your baby's age, and they are all virtual now. But just that other new mom support is really, really important. And then physical support. Do not be afraid to ask for physical support when you need it. Maybe having someone that can help take care of the baby, help do some housework, run some errands for you. Anything that can give you a break in the day, give you some rest, can make a huge difference in how you feel. Also, keeping a journal, writing down your emotions and thoughts lets everything out on paper, and that can be a huge stress relief. And it also helps you to process your feelings in a more objective way. So, journaling is a wonderful tool. And lastly, you need to be realistic about your expectations of yourself. Give yourself credit for the things that you are doing. Give yourself permission to feel what you feel, whatever you are feeling. Do not judge it. Remember that nobody expects you to be perfect, and ask for help when you need it. So, those are the things that you can do. Those are the tools. And so, let's say you do need help. Where do you go for help? That's our last question. So, you can always reach out to your OB or your family doctor. But there's a lot of great websites that I am going to maybe send, so that they can be on a link or something afterwards, that give you a lot of information, and a lot of them have provider lists. So I'm just going to go over them quickly, but then hopefully we'll provide a link for you guys later. So Postpartum Support International, www.postpartum.net, is a wonderful resource. They do have a directory. It's the psidirectory.com. Postpartumprogress.com is another great website. The hopeline.com is a depression hotline. It's also 1-800-PPD-MOMS is the phone number for it. In Los Angeles, there's the OCD Center of Los Angeles, specializing in the treatment of postpartum OCD. And I'm sure even if you're not in Los Angeles, they probably can help you. For men, we also have postpartummen.com. And then also, this is a Los Angeles based, but Maternal Mental Health Now. And the website's maternalmentalhealthnow.org. They have amazing information, and they also have a directory that's more toward the LA area. There's also a couple of apps. One is called Overcome Postpartum Anxiety and Depression. And one is called MGH PDS. which is MGH Perinatal Depression Scale, the Center for Women's Mental Health Center. So those are two that I know of. There might be more, but those are all great resources. Okay, guys, so that concludes my talk. I'm going to check in and see what questions we have. I do see we have a couple. So not really seeing any questions. I hope I'm not missing them. Does anyone have any questions? I'll give you a minute. I see somebody wrote same-sex partners as well. Yeah, absolutely. This applies to any, like men, women can both get a PMAD. Their partners can be helpful. So doesn't only apply to couples where there's a man and a woman. It absolutely can apply to same-sex couples. I'm not really sure what the question is, though. Okay, I'm trying to see. Okay, oh, okay, I'm seeing some questions now. Great. Sorry, guys. Okay, if you are on an SRI already, are you less prone to get this? For example, taking Lexapro and will go back up. Yes, so absolutely. One of the things you do not want to do is stop taking, if you're on an antidepressant, you do not want to stop taking it if you find out you're pregnant. So you do want to stay on your medication. You want to make sure you are at a dosage that works for you. And so talking to your doctor about that, and yes, that is going to be very, very helpful in decreasing your risk of getting a PMAD. Absolutely. What's the likelihood if you have some variation of perinatal mood disorder the first time around? Will you get it again? Okay, so yeah, so the research says that 50% of women who have had a PMAD the first time around are at risk of getting it again. That doesn't mean you definitely will. And certainly what it means is just knowing that you're at risk to prepare yourself ahead of time. So it might be talking to your doctor about an antidepressant. It might be going to therapy ahead of time. It might be really, working with your partner about, okay, if this happens, what do we do? How do we handle it? The more in control you feel, the more options you have, the more resources you have, will certainly help lower the risk. So you are at a risk if you had it before, but it doesn't mean you definitely will get it again. Okay. Thank you so much. I'm working with my psychiatrist. I will go down 3 weeks before to subdue side effects, but of the. Okay, so yeah, so someone was just saying about, maybe going up or down with their medication. And again, it's really about you having that talk with your doctor, because what you don't want to do is, like, if you're at a level that's working, to go to a level that's not working, right? So it's about having these conversations. And if you have a doctor that you work with that you trust, they're going to know you and your situation, and that's going to be the best situation. So don't just, like, I just always say, don't on your own just go, oh, I'll wean off or I'll drop it. Yes, there are, some risks to being on medication, but there are also many risks to your baby if you need a medication and you're not on it. So a lot of times those risks are stronger. So it's really, really important not to make any of these decisions without talking to your doctor about it. Would a chiropractor help with postpartum depression? It's not one of the empirical uses of help, but possible. If certainly if you're dealing with physical discomfort, and physical discomfort can absolutely cause or be a risk factor in getting postpartum depression. So or PMAD. So if you have a chiropractor that helps you stay in line, that alleviates any kind of discomfort you're feeling, then that absolutely can help. I know, yeah, and acupuncture. I know people do say acupuncture can be helpful. Um, it can't hurt. So yeah, so absolutely, that's a thank you for saying that. If you want to try chiropractor, acupressure, acupuncture, it can help because there, definitely are people who say that um, helps with their mood. Okay. Okay, I've spoken with two different ones, but they haven't been helpful. So trying to find one who feels a bit more sophisticated. Hmm. Okay, well, maybe looking on the PSI website. I know they have a lot in their directory, so possibly they might have a chiropractor or an acupuncturist that specializes in maternal mental health. So um, I would definitely look on their website for that. Okay, guys. I think that's it. So I hope this was helpful. And again, I will send Hatch the link of the websites that I mentioned. And it's been a pleasure. Thank you. Thank you, guys. I really appreciate it. Have a great evening. Take care.